This is your Houston chiropractor, Dr. Gregory Johnson, and we have Christina here visiting with us for the first time today. And I have already done her orthopedic neurological evaluation and history. And Christina comes to us from suffering from neck pain that radiates all the way out into her left shoulder and arm and all the way down in her hands and fingers. Also causes numbness to go up into her face, and her TMJs have issues. And she feels this real nervousness or stress called fight or flight. That's what we call it. It's the autonomic nervous system distress. And this has been going on for how long?
The fight or flight since 8 months ago, and I also have some GERD stuff that's been going on for 5 years probably.
And what's your medical doctor doing for you?
Pills, more pills.
Is that helping anything?
No, I've been trying to get off of them. That's why I'm here.
Okay. And we don't really prescribe medications as chiropractors, nor do I ever take patients off their medication, but as we adjust their vertebral subluxations in their spine and help their nervous system function properly, we encourage patients to go back to their medical doctor and then try to work with them on reducing their medications. So we're not treating her for GERD. I'm not treating her for brain disease or colon disease or asthma or allergies or anything. What we are going to be examining her for today is a condition known as the vertebral subluxation complex. The medical profession, coincidentally, don't even acknowledge that the vertebral subluxation complex exists. However, they are still suing the Texas Board of Chiropractic Examiners ongoing, and now are trying to prevent patients like Christina from coming in to see me or any other Texas chiropractor directly to treat vertebral subluxations, which they don't even believe in, but they're trying to block us from treating them, and nerve conditions. That's what chiropractic is all about, is the spine, vertebral subluxation complex, and the nervous system function to every organ, muscle, tissue, and cell in her body. And I'm going to show you something here real quick that we did today in evaluating her posture. Now, she also has a lot of stress in throughout her mid-upper back region here, and that's the area that the sympathetic nervous system comes out of. If you don't mind turning sideways just a little bit, you can see how her head's way forward, and she's got an increased curve right in this area of her spine, thoracic spine. That's called a kyphosis. From T1 all the way down to L2, the sympathetic nervous system comes out and has chains that go up and down on both sides, and it reflexes back and forth. And when you have sympathetic nervous system dysfunction, it can cause things like stress, anxiety, that fight or flight feeling. It can cause decreased blood supply to organs and tissues. It can also cause dysfunction in a person's normal everyday metabolism, if you will, their bodily functions. So we're going to be evaluating her and treating her today for her vertebral subluxation complexes, which we're still allowed to do at this time, but I'm going to put a link in this video about how to support the Texas Chiropractic Association in this ongoing fight against the Texas Medical Association, that they continue suing us and submitting briefs to how we shouldn't be treating patients' vertebral subluxations or nerve conditions, which is just insane. What would you think? What do you think about that, Christina, as a citizen of the state of Texas? Do you like the medical profession trying to take away your freedom of choice?
Absolutely not.
You pay your taxes, right?
I like options.
Yeah.
I feel like I know my body best in some cases, and I want to have some choice.
Right. Very good. Well, thank you. So we want to thank you for supporting the Texas Chiropractic Association. I'll put those links in the description box on this video, and we're going to go ahead and do Christina's evaluation for you. So I'm going to have you close your eyes, and we're going to flex your head forward and backwards again. Now see, she's got not really limited range of motion, but she's got some stress and painful range of motion. When you went forward all the way, it pulled in here, didn't it? And then when you went backwards, I bet you it kinked up right there.
It pops.
Yep. Okay, now if you look at her from the front, you can see her head's way forward and pointing down. Her ears all the way out here in front of her clavicle. Her head is also translated to the left. I knew she was a side sleeper as soon as I saw her, and she told me she sleeps on her left side. But see, her head turns this way most of the time. So she's got three-dimensional biomechanical subluxations in her cervical thoracic spine region, including all the way up here to her occiput and atlas area, which is what's causing a lot of this stress and numbness up in her face and dysfunction that she's having up there in the atlas region. Now down here in the pelvis, don't move your arms. She has no space over here on the right whatsoever compared to the little space here. Do you see the difference there? Your pelvis is shifted to the right of center. But the biggest thing is when you look at you from the side, just look in the mirror over there now. Do you see how your head's way forward?
Yeah.
And you see that increased curve right there? That's called a kyphosis. Okay. So I've already done her orthopedic neurological evaluation, but I'm going to do a couple of highlights for you. Go ahead and sit right here for me. Okay, this is called a foramina compression test, and I did that. That didn't really hurt her anywhere. So then, this is called a maximum foramina compression test, and when I did that, she did feel some pain in her upper cervical spine there on the right, correct?
Correct.
And then when we went back into the left and down, where did you feel pain there? Kind of in the mid-cervical spine area, right? So we do a lateral flexion on her, and we find out that stretches and causes her some discomfort in that upper and mid-cervical. If I do that, which is a shoulder depressor test, that's positive because that increases the pain. And then if we go this way, that one probably doesn't tighten up as much, but still does right through here in her traps. And when I do that, that does make that worse, right?
Yes.
Now this is a really important test that we do. It's called distraction. So when I'm lifting her head up, besides my thumb sticking in her skull back there, did that feel better to your neck?
Like up in here.
Did it release some of the pressure up there when I lifted it up, with the exception of where my thumbs were?
Yeah.
Okay. So then we did muscle test on her deltoid. I'm going to push down, resist. Her deltoid's strong. I'm going to push down, resist. Her deltoid's strong bilaterally, 5 by 5. Okay, I'm going to pull out and test her biceps. Hold. Good. Now I'm going to do triceps. Hold. Good. I'm going to pull out. Hold. Good. Now I'm going to push in. Hold. Do that one again. There we go. That's it. Brain function from your atlas being subluxated. So we test her reflexes, and you can see she's got +2 equal and active reflexes bilaterally. Good reflexes there, and her brachioradialis and triceps.
Excuse me.
Her left knee reflex good. Her right knee reflex is good. Her ankle jerk reflex is good. Everything's +2 equal and active there. Hold your thumb and little finger together for me. I'm going to pull this apart. Hold. That's strong. That's a little weaker on this side, and she's been having some problems with her wrist, and as I palpate her wrist, I can hear the crunching in there. Yep. Okay, so let's go ahead and lay you on your tummy and get your first adjustment today. I'll show you a couple tests I did down here too. Her right leg is short by about 1/2 inch in this position. Now when I bring it up, it actually gets even, and that tightens up in her low back and her thighs, especially on that right side. And then she's got a SI joint palpatory swelling right here, which is an indication of a sacroiliac joint subluxation on the right. And that's tender when I touch that too, huh? And then she's got tenderness right here at L5 when I touch that, and she's got very tight paraspinal muscles that are all sore. All the way up into her lower thoracic spine, right where the curve changes from the mid-thoracic to the lower lumbar curve. Goes from a kyphosis to a lordosis. Now she's got way too much kyphosis, so she's got a lot of extra stress right in here. You go to the bathroom frequently?
No.
Okay.
Oh,
Your ribs are all sore there though, aren't they?
Yeah. Everything hurts.
And yeah, see, she's really just tender all over in her muscles. A lot of diagnosed patients that come in here have been diagnosed as having fibromyalgia.
Yeah.
You've been diagnosed
No,
with
I
that?
have not, but I've wondered because there's so much pain
She's
all
got
over.
tenderness on the right there, and the left right there. And then her atlas is sticking out like a coat hanger on the right there.
Yeah, that hurts.
That's really sore, isn't it? Yep. Alright, so we're going to give you your very first adjustment here at Advanced Chiropractic Relief. Now, she's been adjusted by other chiropractors before. This is her first time coming in here to our office, so I'm going to adjust her SI joints first. Just breathe and relax. You get the easy job. Good. Okay. A little lighter than the last patient we had in here, so adjust the table a little bit. Now some of these joints will be a little sore when I'm adjusting them at first, just because they've been out for so long. They should feel better when I get done. As I always tell people, you feel a lot better when it quits hurting. There we go. Okay. Now I want you just to breathe normal and relax. Perfect. Good job. Yes, ma'am. Okay. Let me have you here and just exhale. Perfect. There it is. Super. Okay. Just relax everything and let my hands sink in here. There's your cervical spine. I'm putting a curve back in her cervical spine now. There we go. Now I'm bringing her whole head back up over her thoracic spine where it's supposed to be. You can already see that curve's gone down a little bit. Let's go ahead and lay on your back. You feel all the movement?
I totally feel it in my back, and upper back.
Yep. Okay. So now I'm going to bring your head up and back to where it's over your shoulders better. Good. Now, if you'll put your arms straight out to the sides for me, palms facing up, slide down this way about a ½ inch. Good. Now I'm going to adjust her shoulders, her AC joints, her costosternal joint right here, anteriorly, and then her anterior ribs where they attach to the sternum, because she's had rib pain that comes all the way around into her sternum. There, okay. Atta girl. I'm sorry, I know those were sore.
It's okay.
Okay, just relax your leg in my hand. There you go. Now you should have felt that from your ankle all the way up. How about that one?
Yeah.
Feel that one all the way up?
Totally felt it in my lower back.
Okay. So got just a little bit of anterior pelvic rotation still, right there. Good. Okay, let's set you up and face towards Renee for a second. There we go. Now, she had a window louver from an RV fall on her head several years ago and compress her spine. So we did the foramina compression test, maximum foramina compression test, which are positive bilaterally. And then I did the decompression test on her that was positive for relieving that pain. So she is a candidate for the manual spinal decompression adjustment, which y'all have come to love and know as the ring dinger. There we go. Okay. Now, let's come over here on this table. And we're going to have you lay on your back with your pelvis right there and head up this way. She's going to fit in the very last pegs here. That feels tight, doesn't it? Okay. And once you get away. Just let your legs bend and relax naturally. This is how you should start sleeping, by the way. It's on your back with no pillow. I know you're used to using a big pillow, I can tell. And your legs up like this, parallel with the floor. Now that should feel fairly relaxed to your back with the exception of these pins.
Yeah, that's on my hips.
Yeah. Okay, keep your teeth together and just breathe. No, you don't need to clench them, just together. Okay, just breathe normal. There you go.
Oh, jeez.
You should have felt that all the way down.
Oh, the freaky way down.
Yeah. That's why we call it ring dinger. See, you're still kicking. You're good.
Oh my goodness.
Well, you put that very nicely compared to a lot of people that did it for the first time.
Oh.
There you go. Good job. So that is a full body adjustment. But that'll help breathe. You probably felt that a lot right through your mid-back and your rib cage. So it kind of knocks the air out of you a little bit. Okay, let's go ahead and sit you up sideways here. And we're going to stand right here in front of the mirror again. So now I'm going to try to reteach your cerebellum how to recalibrate your posture. So, there, I'll turn that down. So I want you to close your eyes again and bend your head forward and backwards for me, please. And then back to neutral. Okay, so your head's still a little forward and left. Do you see that? So here's your homework. I want you to lift both shoulders up. Simultaneously pull them back. Flare those like that. See, that tightens up that whole trap there? Okay, now your head's forward and left, so we're going to bring it straight back. Spread your feet a little further apart so I won't knock you off balance here. See, straight back this way. You're to the left, so we're going to go right. Now look at the wall behind you. You're going to feel a little tap right there. You're going to feel another little tap right there. Okay, now you can relax. And when you bend your head forward and backwards again, Christina, I want you to tell us if this feels any smoother to you than the previous ones.
I feel like I can build it forward more.
Without it pulling so badly?
Yeah, and back.
And definitely go back more.
Yeah, it doesn't. I
Look
don't
at
feel it
neutral
so
now.
much.
So you're more centered now than you were when you walked in. And you got space now on both sides here. Your hands are at your sides. Turn sideways. Your head's still a little forward, but you don't have as bad of a kyphosis up there right now.
Right.
So we're going to do this exercise. Translate right, and then look at the wall behind you. You always want to look in the mirror when you're doing these, or else you'll be tilted like that. So pull your shoulders up and back first. Head straight back. No, you're tilting it back. Bring it straight back this way first. You're to the left, and then shift to the right. See? That's translating, not rotating.
Okay.
And then look backwards simultaneously. And do 15 of those in the morning, 15 of those around lunch, and 15 in the afternoon. No, so you're tilting again.
Her feet are too close.
You want to translate your feet
Oh,
are
I
too
gotta
close
move
together.
my lower body.
Yeah. Well, you don't have to move it. Just pull these shoulders up and back.
Okay.
Okay, now bring your head straight back. Translate it backwards. Good. Now translate it to the right. Like that. Now you look backwards. Right there. If you do that 15 times in the morning, 15 times around lunch, and 15 times in the afternoon or early evening, that will help you to start remodeling the muscles and ligaments that are responsible for holding your spine in its position. And you'll start remodeling to a better biomechanical alignment than you're currently in and have adapted to over the years.
Right. Okay.
Do you feel better right now than when you walked in the door?
A little sore.
Right, that's normal.
But my neck feels much more open.
Mm-hmm. Do you feel like you can breathe a little easier?
Yeah, I mean, my back doesn't feel as tense either. I don't,
Right.
Yeah, my upper back. And
You probably shouldn't feel as nervous right now or stressed
no,
out
actually,
either.
I don't.
Good.
That's great because I was nervous when I got here. I'm not gonna lie.
Yeah. Okay. Well, I'm going to do one more thing on her, and I want you to know that I do not treat acid reflux, hiatal hernia, or GERD, but 50% of the entire population has it, and they come in here and they tell me about it in their history. So I've adjusted the part of her thoracic spine and rib cage that's responsible for her diaphragm strength. So now I'm going to lay her on her back right here. Okay. Just relax your hands right here. Take a deep breath in. Exhale. It's going to be a little tense at first. grabbing your tummy right there and pulling it straight down. You'll feel a little gurgling in there.
Yeah.
Did you feel that? Okay, another deep breath in. Exhale. Good. And a deep breath in. And then exhale again. Yeah, did you hear that gurgling going on
Yeah.
right then?
Immediately.
Yeah. Keep exhaling just like that. Yep. That's deep, isn't it?
Yeah.
Now this is right here. Is that sore too? That's your ileocecal valve.
Yeah.
Have you had some constipation at times?
Yeah, life.
Okay. Lifetime?
Yeah.
Well, you should go to the bathroom within the next 12 hours.
Okay.
Okay, let's go ahead and sit you up here now. And I want you just to walk around the room and tell me if your body feels different right now after your first adjustment. And in what
My
way?
hips feel different.
Right?
I feel like
You feel more centered?
I do. I feel more grounded. That's the word I was thinking.
Okay,
It was like
good.
in my
Well, your
back.
head's not so far forward yet now either.
Right, and my posture feels a little more back.
Up and upright.
Yeah, and my neck doesn't hurt.
Good.
You know, and my jaw's not tight anymore like it was when I came in.
Oh, good,
So,
good.
yeah.
So the TMJ has the most nerves going to it than any other joint in the body. So when I adjust her atlas up here, it does affect her TMJ joint, and that's why she's feeling better there. So being a Texas citizen and having the right to choose chiropractic as your healthcare choice, and it's a lifestyle choice, just like working out's a lifestyle choice, eating properly is a lifestyle choice.
Right.
You know, we don't try to prevent people from going to the medical doctor for acid reflux or GERD. That's their bailiwick. That's what they do. I don't operate on people's gunshot wounds, but they don't adjust people's spines and help their nervous systems through spinal adjustments either. So we each have our place in the healthcare industry, and we do just like for you to help the Texas Chiropractic Association maintain that autonomy for chiropractors to be able to be primary portals of entry for patients like Christina and other citizens of the state of Texas to seek chiropractic care first as their choice. And most often they've already been to their medical doctors for years for these same problems. Is that correct?
Correct.
So would you encourage other people to seek chiropractic care for these conditions?
Definitely. I mean, if you're looking for an easy way out on some things and you just want to take a pill and you can get by with doing that for years on end.
And a lot of
But I
people
found
do that.
my symptoms were compounding over that time, and
To even taking all the medications.
yes, and they weren't helping, and I was prescribed more of it, and I became, side effects, and I don't want those side effects, so I'm looking for a different route.
Right. It's an alternative source of
Right.
treatment.
Right.
Mhm.
And I feel that's important to have that choice.
Yes, it
Yeah.
is. It is. So make sure you tell all your friends that, and your
Well-
congressman, and support the TCA, and we'll leave that link in the description box. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon.